Joining us now is Geri Spollett. She is President-elect of Healthcare and Education for the American Diabetes Association, an adult nurse practitioner, Associate Director of the Diabetes Center. She's affiliated with the Yale School of Medicine faculty. She also serves on the advisory board of the Aventis Pharmaceuticals Company, a division of Eli Lilly, and GlaxoSmithKline. Do you have diabetes, Geri?
No, I don't, Larry.
What made you so active in this fight?
Well, when I first started nursing, I was at a hospital that was located right next to the Joslin Diabetes Center. And so I saw many of the patients from Joslin that were hospitalized, and I got to be very interested in how diabetes impacted their life and the role that nursing can play in helping make that life better by education.
Now, is the American Diabetes Association focused on both types, juvenile and type 2?
Yes, it is. We believe that diabetes affects all ages and that we should be there for all of those patients. They're all part of our focus.
Now, I had a heart attack and subsequently bypass surgery, and then subsequently discovered I had type 2 diabetes. Diabetes is a forerunner for heart disease, is it not?
Absolutely. Cardiovascular disease is rampant in patients with type 2 diabetes, and it's not unusual for patients to have a heart attack and then find out that they had a background of diabetes that was undiagnosed.
What are the principal treatments?
For diabetes?
Yeah.
Lifestyle changes are most important in terms of eating programs and exercise. Those are always going to be the basis of care. And we have oral medications that will help control blood sugar and as well as insulin. And
the insulin is more with the juvenile diabetes, right?
Well, insulin needs to be used with those with type 1, absolutely, but there are many patients with type 2 that go on to need insulin.
Is one a bigger killer than the other?
No, not really. Both are very serious diseases and should be treated as such.
Any differentiation between either ethnicity or religion? Is there more diabetes in blacks than in whites?
Yes, there's more diabetes in Hispanic Americans, African Americans, Pacific Islanders, and Aleuts or Eskimos. That seems to be an area where we see lots of type 2 diabetes. Among the Native Americans, particularly the Pima Indians, who have been much studied, we see that diabetes is a big problem for those people.
Any groups or people in the world without it?
No. There are some cultures where diabetes is of lower incidence than in the United States, but in most of the developed countries, diabetes is quite high, and as the countries become more prosperous, like we're seeing in India, the numbers of diabetes rise.
Now, lifestyle is a big part of it, though, right? Especially type 2.
Yes, absolutely. And I think that one of the reasons we see some of the countries that are having an economic growth have more diabetes is that the numbers of obesity are also rising, and there's a big link between type 2 and obesity.
Would you call it an epidemic?
Absolutely, yes. Yes, I would call it an epidemic because there are 26 million Americans with diabetes, and that number is growing. It involves both children and adults, and we're also seeing type 2 diabetes in children, not just type 1. So we don't use the word juvenile diabetes as much because it's not specific only to children.
Would you say there are many people who are walking around with it that have not been diagnosed?
Yes, we know that for sure, that there are people who have pre-diabetes, but they also have overt diabetes and they've never been tested for it. We ask them to please, if they have a family history, if they're overweight, they have a sedentary lifestyle, or if they belong to one of the groups that I mentioned, that they ask their physician to screen them for diabetes. It's very important that they get treatment early.
Now, there have been advances. Certainly pharmaceutical advances have been tremendous. How confident are you of that major step that day when we see the headline?
The headline being diabetes is cured? I hope for it. I pray for it. I don't know how far in the future it is, but I know that we're making advances all the time. I tell my patients to be hopeful. We now have treatments that are better than ever. When I started working in diabetes over 30 years ago, we had a very limited group of medicines that we're able to use, and now we get better results and we can keep people healthier long term with the tools that we currently have.
So you certainly encourage people to help all they can, right? Even if it's just giving donations.
Oh, we can always use donations because the American Diabetes Association puts those donations to excellent use with research and also funding programs to help people with diabetes live healthier lives.
A couple other things. The internet is a wonderful thing, but it also has some dangers. And people tell me they see on the internet that there's a cure for diabetes.
Yes, the diabetes cure issue on the internet has been something that's been around as long as the internet has been around, because anybody can post something on the internet. And so we tell patients, be careful what you're reading, look at the source, see whether or not it's evidence-based, if there's any research to uphold it, and above all, talk to your healthcare provider about it so that you can really get what the scoop is.
Geri, thank you so much for your work.
Well, thank you, and I hope you are healthy with your type 2.
Thank you, Geri Spollett.